ado, I did notice that our speaker was here, and we have Dale Long, who was a member of the same club, I believe, to introduce her. So Dale, the floor is yours.
All right, thank you very much. I have a 6-page document here, but I'm going to go quick. I know Kristin as a Rotarian first. She joined our Encinitas Club in 2004. And every time she spoke, there was a sense of clarity in her message. Then in July of 2008, she became president. Every meeting was packed with engagement, wit, games, challenges to all of us. I started thinking she had unlimited focused energy. The discussion at our table asked how she packs in so many relevant, important activities into a 24-hour period. We talked about it for weeks and realized she just doesn't sleep. Anyway, in 2008, 2009, Kristin was president and set the seed for the home team, and the members picked up the ball. They're still doing light repairs for seniors today, and our club here in RV is doing the same thing. A big memory for me was the full engagement of our members. She was tough but fair and expected the best. I know her to be an organized, big picture sense person, but she sees the activities needed to get the big picture. And then she sets the division of tasks to make sure everyone is doing something. I read through Kristin's bio and I cut out big chunks, but Kristin was elected to the County Board of Supervisors in 2016 for 4 years and served as the mayor of Encinitas. She is a mother, community leader, small business owner, working CFO of her family small business with 7 locations, employing 150 people. The youngest woman ever to be elected to the Board of Supervisors. And this is important. Kristin used her private sector small business experience to push government as a catalyst for private sector and nonprofit efforts addressing challenges facing the San Diego County. There's 4 or 5 lines here that are significant that I'm gonna ignore, but just this morning, I was watching the news on KUSI and 710, and Kristin is talking about the need for local control in San Diego County to use local data to create sustainable local metrics that will work for our county, all the while emphasizing that this is a dangerous virus and we need to take it seriously. A San Diego native, Kristin attended Arizona State University where she earned her bachelor's degree in broadcast journalism. She and her husband, Dr. Paul Gaspar, have 3 children and live in Encinitas. Fellow Rotarians, please help me welcome County Supervisor Kristin Gaspar.
Well, good morning, RB Sunrise Rotary. What a pleasure to join you today. I don't think we acknowledge enough the people that fundamentally shape our lives. And there are 2 members on today. They're such important people to me. You're very special. One did my introduction today, Dale Long and Carl Cruz. I just want you to know how much I appreciate you and how you helped shape me, not only as a young Rotarian headed into a leadership post within Rotary, but as a human being, as a businesswoman, and you need to be acknowledged. And please know how grateful I am. You know, I was told my camera's off. It had to be off because every time I hear Dale speak, it brings back fond memories of my year as president and the deep appreciation I have for my club members. We're a family in the Encinitas Rotary, and I miss them dearly. When I became county supervisor, it was difficult to make our noon Wednesday meetings as I'm downtown San Diego, and I miss my Rotary family, but appreciate and love you always. So thank you for having me today. Wow, there is a lot going on. I say if I look a little tired, it's because I'm a lot tired. There is no sleeping, and thankfully I've been conditioned this way for many years. I never want to be in the middle of a pandemic again. This is day 192, if you can believe it, of the pandemic response here in San Diego. I wanted to take the opportunity to really reflect on where we've been and where we're headed. This issue is top of mind for so many people these days. And I want you to know how I've experienced this pandemic from multiple vantage points. As Dale indicated in his introduction today, I'm a mom. I've got 3 kiddos, and I've got that tough age group. I have the teenagers. My, as if that isn't hard enough, try having teenagers in the middle of a pandemic where you suddenly have to become their homeschool teacher. Now, unlike many of my friends on Facebook and people in my news feed, I am not excelling at this at all. I am daily email exchanging with the counselors at the school saying, help, 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 help. And it's really challenging. I tell people it's hard. It's really hard to watch my kids literally rotting in front of a device day after day after day, and not being connected with their passion and their purpose, their friends gone, their sports gone. This is really challenging. And as a parent, it is one of the toughest things that we've experienced. Shout out to our teachers. They've done such a great job with an impossible task. So it has nothing to do with them. But really important that these kids are considered as we move forward. The second piece is a small business owner. When this pandemic first hit, we were very, very concerned, obviously, with our own business and the businesses that surround us in the community. For us, we have 150 employees, and our initial thought was, this is a giant cash on hand game. How long can we keep everyone on payroll? How long can we cover their medical benefits? And what do we do about individuals that can't report to work, whether they have childcare concerns, whether they have health concerns, or whether they're just concerned overall to be working in the middle of this pandemic? And we quickly had to shift our business to make sure that we provided as many employment opportunities that people could put food on their table. But it's been a challenge. The next piece, as an elected official, I am one of 5 sitting in the seat that is in charge of this pandemic response. Now, 6 months ago, most people had absolutely no clue who their supervisors were or what we even did. That has quickly shifted as a lot of time and attention has been paid to the County of San Diego that's in charge of public health and this response, along with our clinical leadership team and of course our public health officer. When this first struck, my initial thought was we have to maintain hospital capacity. That was the goal, right? It was 2 weeks, flatten the curve, make sure we don't overwhelm our hospital system. I went to work straight away on that effort. We did some really creative things that you may or may not have even heard about. The first project I had the pleasure of working on was a partnership with UCSD. We had sent all of the students home from their housing. And what we wanted to do was create an alternative care setting for lower level patients that weren't really needed to be in the hospital at the time, but they still needed care. We needed a facility where doctors and nurses could live alongside their patients that they were caring for. We were able to quickly stand up 350 beds within UCSD student housing, but we weren't done yet. For me, I wanted to make sure that we were well protected. We heard a lot about potential surges, and 350 beds extra didn't seem like a whole lot. I want you to know how thankful I am to our area hospitals. We have 22 hospitals in the San Diego region, and they quickly flexed to operate as one healthcare system. This didn't happen in every county, in every state. If you take, for example, New York, the governor there reported that what they should have done better is originally come together with their hospital system and flex and operate as one. That would have made a significant difference there. So we were able to apply lessons learned in San Diego. Hats off to our hospital providers that have been nothing but collaborators throughout this pandemic, whether it be keeping inventory of PPE, keeping inventory of ICU and hospital beds, and sharing that information on a daily basis. So the next step was to build capacity further. I was able to leverage funding from the federal government. They gave us what was called a pop-up hospital. These were 250 hospital beds equipped with everything that you would need to treat a patient. Our one problem being no hospital to put the beds in. All we needed was an empty shell space. And as it turns out, one of our hospital partners stepped forward. Palomar Medical Center had just built their new hospital. They had 2 floors of empty shell space, and this was the ideal setting to quickly stand up 250 additional beds. I want you to know that those 250 beds at Palomar and the 350 beds at UCSD never had a head hit the pillow. And that's a big compliment to our hospital partners and our community overall for their attention that they paid to this pandemic and the enormous measures that we've gone through to manage this situation. At this point in time, we actually shut down the UCSD facility. We still have the Palomar Health beds as potential surge beds when we move forward. Next, I shifted my attention to our small business community. I quickly began writing safety protocols so that when we were given the green light by the governor for a potential business sector to reopen, that they were indeed ready. This included so many site visits to unique businesses where they wanted to make sure that they were doing everything right. We would come up with these safety plans and protocols. We would put them in the hands of our CAO and ultimately our public health officer. And day after day after day, it was a grind just like this. So many memories come to mind of walking into the county building, which was closed to the public, pitch black, using my cell phone flashlight to find my way to my office. My thought was, first man in, last man out. Every day that I do this and I give this job 1,000% is one more day we don't have to do this. Make no mistake, I don't want to do this one more minute, one more hour, one more day than is necessary to safely move us beyond all of this. At this point in time, you hear me frequently talk about the need for local control. We've learned a lot about the pandemic over the past 6 months. One thing that we've learned about for the very first time are impacts back to our community that are never talked about. I had asked for the County of San Diego to bring forward a panel to talk about how well we're doing as San Diegans. How has this pandemic changed our lives and how has it shaped our health? And the results of that were pretty stunning. I want to share with you some information that we gleaned from the last meeting when experts came to talk to us. First, the economic hit that San Diego has experienced. Pre-pandemic, we were pretty much recession-proof here in San Diego. Our local economy relied a lot on innovation, it relied on the military, and of course, tourism. These are sectors that are pretty much resilient to a recession, and we've seen that before. However, it turns out that we're not pandemic-proof here in San Diego. At this point in time, the projection for economic recovery for San Diego is the year 2026. At this point in time, 250,000 San Diegans are out of work. This isn't even the high that we experienced during the pandemic. The 250,000 people, think about that for a minute. We know that this is actually twice as many people unemployed in our region than if you added up all of the years of the Great Recession combined, so an all-time high. Turning to mental health, we've seen a tripling rate in rates of depression. Severe depression has gone up in individuals in San Diego by 500%. We've seen a dramatic increase in overdose deaths. We've done a lot of advocacy these days about dangerous fentanyl. This is being laced in tons of products here in the San Diego region. We've seen triple the number of overdose deaths from dangerous fentanyl during this pandemic period as compared to all of 2019. 2 weeks ago, I stood outside the county building and honored the lost souls to drug overdose that we've experienced. 645 people lost their lives to overdose. And out on the lawn of the county building, we honored them with their names, and we shared with the community the type of drug that they overdosed from, so people are well aware of the situation at hand here in San Diego. A lot of people disconnected at this point in time from mental health services, from substance use treatment services, and that's highly problematic. Although, like other communities, we haven't seen a dramatic increase in our suicide rates here in San Diego, our docs expect that that impact will still come, and it basically trails all of that depression that I've covered here. So there is a lot at stake. We have 1 million people in our safety net programs at this point in time, 1 million San Diegans, 900,000 people that have absolutely no idea where their next meal is coming from. Rotarians, we are needed now more than ever to pull ourselves out. Government is not going to be able to solve all of these challenges alone, and we are going to have to dig deep as a community and come together And I think that Rotarians are brilliantly prepared for this task. I look forward to working with this club and many others in the coming years to make sure that we get back on our feet as San Diegans. Please know that not everybody has experienced this pandemic the same way as you. You know, it's easy for us to pass along assumptions on others, and that mantra of we're all in this together. We're absolutely all in this together, but in very different ways. There are a lot of children right now that are in very dangerous, unsafe homes. Think about this for a minute. Rady Children's Hospital reports that they've seen more severe child abuse cases in the initial 3 months of the pandemic than they saw in all of 2019. There were a lot of kids suffering out of sight, out of mind, no eyes on them. Teachers, coaches, they don't see their kids right now, and this is leading to a big problem. Same with domestic abuse. Our calls to domestic abuse hotlines, child abuse hotlines are down 50%, which you would think would be an amazing success, but it's a very scary statistic because people are not able to escape those who are inducing this harm. So now is the time to reach out to people that maybe you haven't seen during this pandemic period. Where are they? Make a phone call to someone that you haven't heard from. If we all did this, it would have a ripple effect. If you are a coach like I am, reach out to your team. Just say hello, find out what's going on with these kids. Very important, and we can all do our part during this particular point in time. Today is a big day. Today is what I've been calling the gender reveal for the state of California. And there's a reason I'm wearing white today, because I don't want to give you any hints, because we're bound by law to not share with you what color the county will find itself in by this afternoon at noon. As you know, the governor recently released a reopening plan that includes a color-coded system. Right now, the county is in the red square, so to speak, and that has afforded many of the reopenings that we are experiencing in our community. However, we are in a situation where perhaps we are going to take a step back into the purple zone, and that would close indoor operations again for San Diego. The reason why we're there, quite frankly, is San Diego State University. Now, please know that the university has been incredible, very responsive, as has the county and our clinical leadership team in quickly containing a spread at San Diego State. But people didn't get infected at school. Please know this. Not one case has been linked back to school activities. In fact, there was very limited opportunity to even be on the campus. The kids were at home and they were Zooming. But these are college kids, and they're moving back into frat houses, student housing, and dorms. And they're coming from all over the world. And for the first time, they're meeting other people. Do you really think they were practicing all of those safety protocols, that social distancing and facial coverings? Probably not. We saw that quickly transpire into over 700 cases. So literally, frat parties and dorms could shut down our entire economy. And we were advocating as a 5-0 board for the state of California to recognize this as a unique circumstance and something that's being well managed by the university and by the County of San Diego, as evidenced by only 10 cases ever escaping that campus situation and spreading beyond into the greater community. That's a big testament to that effort. And we were begging the state of California to please look at things as special cases and do not let our economy close down for a third time based on these cases. And we were pretty disheartened when we thought we had a good seat at the table. We thought that we were negotiating in good faith. And then the governor just made an announcement publicly that he was not going to consider these San Diego State cases. So we've been meeting in closed session to talk about the San Diego State situation. And mind you, we're concerned because UCSD welcomed back thousands of students for on-campus living yesterday. Same with Cal State. This is going to be a frequent occurrence in our community that we're going to probably see some spread with these college kids. And probably high school age kids too. Tough to keep them apart. All we're asking for is consideration for the ability to really examine our local data. Because what we do know after 6 months of work through this pandemic, that it's unlikely that this demographic will turn into hospitalized cases. And the reason why that's important is that it's unlikely that that will overwhelm the hospital system. Still critically important that these kids are not coming into contact with high-risk individuals. Still important that they're not returning to those situations if they themselves are in a high-risk category. But all the same, we don't anticipate those cases to translate into hospitalizations. So what our public health officer has been advocating for is more reasonable metrics that really reflect the underlying dynamics of our community. How we can respond if we see a big outbreak coming from a certain business, for example. How do we immediately address that situation? I can tell you I'm really proud of our clinical leadership team. San Diego led in its pandemic response by over 2 weeks. San Diego is prepared to lead out of this. It's really important that we take a look at the bigger picture. It's really important that we come together as a community. As difficult as this is, and as many days where I think I see light at the end of the tunnel only to find darkness, I think that we will come out more resilient, stronger than ever, if we can come together as a community and navigate this challenging pandemic. So I'm going to stop talking at you. I want you to know that I'm tired, not defeated, 100% committed to seeing us through all of this, and grateful for your help and support. Dale and Carl, I know you'd bother me anyway about repeat contribution back to your fundraising efforts. So in your inbox right now, you'll find my donation form already filled out. Happy to support you and all of your wonderful efforts at the RB Sunrise Rotary, and thankful to be a Rotarian putting forward that service above self mentality each and every day. Happy to answer your questions.
I can't see anybody raise their hand, so.
They're all sleeping.
I got one. First, thank you very much. Secondly, what do you think? I heard you saying that there were a group of California counties that were metro counties, for lack of a better term, that were feeling the same discrepancies that San Diego's feeling with the metrics not being equitable to their situation. I mean, the case right now is one size fits all. We need to demonstrate that we have capabilities to handle this on our own. How is that going?
You know, it's actually going quite well. In fact, those large urban counties are coming out to San Diego on Wednesday to do a press conference together. What we've seen is the emergence of areas like Riverside, San Bernardino, Orange County, San Diego. These represent large urban counties. San Diego is actually the second largest county in the state of California and the fifth largest county in the entire country. So we're one of the big dogs out there, as are these other urban counties. And unfortunately, the metrics of just looking at cases don't work well in large urban counties. So there's a lot of alignment between the urban counties, and we're working through our professional association, the California Association of Counties, and they're helping us with these efforts, helping us to communicate what a reasonable metric would look like. By and large, I can tell you that there's a point of agreement with all of the public health officers in these large urban counties that, yes, you should look at the cases. However, you should drill down further into those cases and really look at the demographical data to project what that hospitalization situation will look like. Often you hear, well, you can't look at hospitalizations because that's a lagging indicator, and that is true. However, we can look at our case data and make some natural assumptions about how that's naturally going to shake out. Because we have the value of a half a year of data underneath us, we can assume that we'll be able to look at this responsibly for our region in real time and make adaptive moves based on what we're seeing on our local level. So if we looked at the university situation for San Diego, we'd say, yes, this contributed to a lot of cases and likely 1,000 cases by the time we're done, but we're not seeing that spread out into the community further. Therefore, is it reasonable to shut everything else down? And the reality is right now, with our business community, we're in a pretty stable place with the reopenings that we've seen. We haven't seen a large uptick from those reopenings. So that's a good thing. So much more responsive. That coalition has been pushing hard and are at the table currently working through CSAC to see if we can experience some movement from the governor's office.
Thank you.
Greg?
Yeah, hi, Kristin. Good to see you. Thanks for your talk here this morning. Curious, when this pandemic was first thrust upon our world and certainly our country, our state, it seemed like we had an objective, we had a target, we wanted to flatten the curve, really relieve the stress that our hospitals would feel in dealing with what appeared then to be a very high death rate for those that are contracting the virus. And it seems to me that maybe the statistics are fooling me, but it looks like our death rate is much diminished from the peaks that we saw before for people that were afflicted with the disease. With the hospital rooms, so much vacancy existing there, what is our target? I knew we had one before, but I'm feeling like if we don't have a target, we're never going to get there. We're never going to get to a finish line. And is it having not one more virus case reported like polio? Or is there something else? I just feel like this is an ongoing saga where, you know, my physician tells me that if I want to know when the pandemic's going to be over, go ask a politician. Is that the case?
Well, listen, I cannot deny that there have been just ever-changing goalposts, and that's wrong. You know, I really think that at the end of the day, we have to return to that original goal. We cannot have our hospital systems overwhelmed. We certainly don't want to see mass casualties as part of this, but we do have to consider the unintended consequences of our response. You know, it frustrates me a bit that our response is pretty much the same as it was 6 months ago, that when all else fails, we just send everybody home. But we know a lot more about how we can protect the vulnerable. For example, if I had it my way early on, we saw a number of deaths in our skilled nursing facilities. And it was because we had healthcare workers coming in from the outside, and unfortunately, someone would become infected and it spread like wildfire within these facilities. This is a highly vulnerable population. I still don't know why, with all of the unemployment that we have out there, we didn't get people that were willing to commit to live on site, embedded in those skilled nursing facilities over an extended period of time until we were out of the woods. For families like mine, I haven't seen my own parents since February, and that's because my mom's in a high-risk category. It's not safe for my mom to go out and about right now. It's not safe for me to go and even visit my mom right now. So I believe that we've learned a lot. We don't need the tape on the ground to tell us to stand 6 feet apart anymore. Have you met a human being that can't figure out that 6 feet apart? You know, they keep saying that the social distancing and the facial coverings are the most important thing. The temperature checks, those are the 3 things that our public health officer says need to remain in place for a while. What we've been trying to suggest is that our business community is prepared as soon as they can safely reopen their business, implementing what's most important to our public health officer. It's same thing with schools. You know, we really need a hybrid option. A lot of people think our schools are open. By and large, they are not, and they will not be open. Our school board just voted for second semester to be at home. The thing is, with our schools, we need to meet people where they are. We need to understand that there are a number of kids that have to get back in the classroom. I have 2 of these kids in my household. One is doing pretty well with the distance learning. But for some families, they have a high-risk family member at home. We've seen multi-generational homes and that structure being problematic because you have a more vulnerable individual there. I say take the teachers that can't return right now and have them work with these kids and families that can't return right now. It just seems to me that we haven't changed a whole lot in our response, despite being armed with all sorts of data that would suggest otherwise. Also, please know, at one point in time, the hospitals were not taking elective surgeries at all. And what they consider elective at that time was pretty interesting. I needed a gallbladder removed, and that was an elective procedure. So I just got to go home and be in pain for a while. But now we've returned to those elective surgeries. So what we're seeing in the hospital system, even though you see that, there's X capacity there, only 5 to 10% of our hospital beds are filled with COVID patients. So again, it's just about, I think, being more responsive to the situation. That's where I believe if we had local control, a lot of people put a lot of blame on our public health officer, but the reality is she's actually fighting for that local control at this point in time. And I do believe if we had it, we'd have a better shot at getting through this without all of the destruction that's occurring with the loss of jobs and increase in overdose and depression and all of those other impacts that rarely are talked about.
Kristin, this has been a wonderful talk. Thank you for your leadership, and your talk this morning was very interesting to me, and I know to a lot of our club members. We appreciate you starting out your leadership in Rotary and doing such a great job and springboarding it from there. So,
well, hey, as an elected official, I have zero privacy, so please reach out to me if you're struggling, you need help. This is what I'm here for, a shoulder to cry on. I'll vent with you, whatever it might be, but thank you for the opportunity to address the group and keep up with the brilliant work. We need you now more than ever.
Perfect. And we don't want to put you on the spot. We realize your calendar is probably super full, but a lot of us do stay on for a few minutes after. If you have time, great. No pressure. If you don't, we understand. But we do want to thank you for your wonderful presentation. To show our appreciation, the Rancho Bernardo Sunrise Rotary Club has made a contribution to the free wheelchair mission in your name, which will provide a wheelchair to a disabled person in a third world country. This wheelchair will give them the gift of mobility and change their life forever in your honor. Congratulations, and thank you for your talk, Kristin.
I got goosebumps. Thank you. Thank you
That's
so much.
awesome. A couple of last thoughts before we sign off. Don't forget, next Tuesday morning, don't show up unless you want to see a blank screen. We are going to have the San Diego Fire Chief be our speaker. Our meeting's going to be from 5 to 6, so we're going to try an evening get together. So bring your smile, your cocktails, and listen to the fire chief. I'm sure that'll be interesting as well. Please encourage your friends and new members to attend that meeting. Try a different time. And I think that's it. So I'd like to ring the bell, and those of you who can stay on and maybe listen to a couple more questions, that's great. And otherwise, we can socialize and have some fun. Have a great week, everybody.
Thanks.
It's not really fair. You can't get your gavel stolen or the bell. That's a catastrophe during a pandemic. I didn't think about that.
That's right. It doesn't walk away and go on trips.
How boring.
See, I have a question for you. In the Matrix thing, it seemed like hospital beds to ICU was a big deal. And now that we know more about it, are we seeing therapies being helpful to prevent that hospital capacity from being absorbed, if you will?
Well, I think some of the messaging out to the public has been important, because what the doctors will share with you is people are waiting too long to come in. And so the word really needed to get out that you need to get in early. The therapies that are effective right now are applied earlier on. The problem is that people are real nervous to report to the hospitals, not knowing if they had the virus or thinking they might contract it there. So we really did need to do some good PR work with the hospitals, making sure that people felt safe. When I was hospitalized for the gallstones, for example, it was a ghost town. There was one other patient in the entire ER. Very safe experience the way they were triaging people outside of the hospital, and you were not getting in there if you had these signs and symptoms. And people just didn't know that. So it created an avoidance factor where, for the most part, people aren't going to the emergency room unless they know it is indeed an emergency. But with our COVID patients, they actually need to get in earlier to have more options for treatment.
Okay, thanks.
Kristin, I have a question. Is the county putting together information that basically beyond the San Diego State students, who's still getting sick? It almost seems like it has to be some very specific groups. Again, I'm obviously a one rat study, but in 6 months, I finally know one other person that has actually had COVID. So there's this, huge amount of people out here that just keep looking at each other going, well, we're not sick. So is there a specific group, and is anybody working to go, let's target those people and see if we can get them to stop interacting and spreading it?
So what we've seen is a real transition, and the younger age groups are impacted. So these are individuals that are in that 30, 40 range. And the thing is that this is a social group, much like the college kids, and they're at an age likely that they have young kids too that feel a need to be social. So actually what we're seeing is a lot of spread that's happening at block parties, barbecues, that sort of thing, where people really let their guard down, so to speak. And it's really unfortunate because so much of this is being pinned back on the business community. But even in our businesses where we have cases and quote unquote outbreaks, that's where 3 or more people have become sick. It's a small number of people, and generally speaking, it's your workforce that's social. And so it's likely that they contracted the virus outside of the work setting when they were interacting with one another. So how I can sum it up best is that the fact that we're human beings and we like the company of others, that's really what's leading to this continued spread out in the community. So to the extent possible, I think that you can still be social, but you can not let your guard down so much that you put yourself in that compromised position. So I am thankful that I see a lot more people who are choosing to be outside in a park, they're choosing to be out at the beach, because we also have learned that outside environments are much better than indoor environments for this too. So that's kind of the best way I can sum it up. But the younger age groups are the ones that we're seeing the largest numbers for, which also make the compelling case for, okay, they're not turning into critical cases for the most part without underlying conditions, and they're not translating into hospitalization. So it makes sense that our hospital numbers are the way that they are.
Anybody else?
Kristin, I appreciate everything that you've been mentioning about, the response to COVID, because obviously that's a big deal. But another big deal that I wanted to ask you about is with the presidential election coming up. Obviously, there's a lot of concern with regard to the protocol, the process, voter fraud, the whole thing. Can you speak on what the county's perspective is with regard to the upcoming election and how that's going to be handled?
Well, our registrar has really done everything in his personal power to make this election successful and to prevent fraud. And in fact, if you're interested in having a presentation to the club specific to what the county's doing, I know he's been all over the place visiting Rotary clubs too and giving this presentation. So I could forward information for Michael Vu so he could address your group, which I think might be helpful. What I will say is that San Diego, I was surprised to learn, as a county, I had asked for an audit of our voter rolls at one point. I think that the integrity of our elections is really important. And we had seen way too many cases of people voting for others. Loved ones that had passed, for example, people were still filling out their ballots. And I thought it'd be nice to have a clean slate and take a close look at our voter rolls. It turns out that we as a county aren't even able to do that. The state of California has to ask for the audit of our voter rolls. So we're completely powerless trying to figure out if we have integrity internally with our own voting system. And I think that's a big problem. I think we should have the ability on the local level to ask for an audit like that, but as it turns out, we don't. So that was really surprising to learn from our registrar, Michael Vu. Having worked with him, I can say that he's very professional. We try to use a lot of innovation. I do believe that he does everything that he can to protect the integrity, so it's not a fault of his, but I do think it will be interesting to hear about all the adaptations and things that will be happening in San Diego.
Anybody else?
Yes. Yes.
Jan, go ahead.
Yeah, since you said we can come to you at any time, I hear from my doctor's friends in the Netherlands that since I have O negative as a blood group, that I am totally prevented as a Caucasian, which we actually can talk about in Europe, as a Caucasian, that I cannot get this disease. The maximum that has been registered worldwide is up to 2 days of disease of the virus for O negative type blood. Is this a
Interesting.
true statement or is this just fantasy?
I don't know. I want to find out. I'm intrigued. I haven't heard that yet. So I will talk to our clinicians at the county and see if they've heard anything or have some research that backs all of that. I do know we need you as a blood donor. We could really use that O negative blood right now. It's been tough during the pandemic period with blood donations overall. We've seen a major decrease, but I don't know. I'll find out and get back to you on that one. First to admit when I'm not aware.
Yes. It's interesting because I've
It
given a
is.
lot of blood in my life, negative. But then I was in India and I got malaria and injections, etc.
Yes.
And now I cannot do it anymore.
No.
Because,
Darn it.
Because,
I was ready to bring a needle
Yeah.
over.
So, no,
I'll
no,
find
I'd
out.
like to know
If you could
because
pass along your contact information,
Yeah.
yeah, that would be great. I just need to know how
Yeah.
to contact you. So just get it to your president and they can pass it along to me and we'll go from there.